as well. You might find it a little boring, my session, but it is little different compared to what we guys are learning about the biological effects of laser. So something I'm trying to teach you something related to something innovative and something new in dentistry. Okay, so as Sir told, the technology is a double-edged sword. If you use it for good, you can use it for healing. On the other end, you can use it for the bad things, right? The same way here also, digital smile design is totally depending on the data, what you guys get it from the clinician. If you get a clear, good, precision data, you'll be able to deliver the good processes. Suppose if the data is wrong, 100% your planning will go wrong, right? So now, in the present era, we are in such a condition where we can merge the STL data, see the face scan, STL data, the virtual articulator, CBCT, along with your 2D images. Such a wonderful concept. We merge everything. We literally have the patient in our hand to design whatever the processes we want to deliver. Right? So having said that, I'll just take you to the basics of digital smile design, because we don't have a language for smiling, right? Everyone smiles in the same language, right? So this smile is good, and for others it might look bad. It's all totally customized. But we have certain golden principles, like what exactly should be the smile, how exactly should be the midline, what should be the smile arc, smile line. So just few basic things I'll just try to show you. So what if, why this fusion matters? Today what we are learning is the DST meets your smile axis. Smile axis is you can say it's a byproduct of your Novales. It's a byproduct of the triple ALT. So with this discussion we came to one mutual understanding, like why can't we use this laser technology in orthodontics, right? So if it is really mattering, really affecting the prognosis of these patients, why not? Okay. The reason why we are using is we get a faster results. This is the game changer. Faster result, predictable outcomes, minimum chair time, and digital transparency. And the clinician also want the workflow predictability, the case acceptance, and the reduced refinements. What if many patients they keep asking how long I should wear these aligners? If you say 2 years, 3 years, then leave it. If you say suppose for the same the Invisalign, the branded company, if it is giving you 1.5 years of treatment, and if you are able to manage it within 7 months, then why not? Right? So patient will happily say, I will go for this right accelerated one, because it has multiple advantages. Like the initial discomfort is less, pain is not there, and the teeth are moving at the patient's comfort. Right? Even if the minor adjustments, the sharp edges, the patient will not feel that pain because of the MIC device what we are giving along with the aligner kit. I'll just show you how it looks like. Okay? So that is the advantage. Then what is DST? Why DST is playing a role here? Because in DST, in all the aligner companies, what they do, they just, suppose if a patient is come with a spacing in the anterior, they just close the spacing and give you that mock-up, right? If they have a crowding, they just try to do some IPR here and there and show you the mock-up, right? But here what we really want to change this concept is, like when we take your 2D images, the 2D images should be ideally good. Initially I told you, it all depends on how precise data we get from the clinicians. I'll come to that later. So with that, we prepare the scale. So what is the scale? It has this red marking and the white marking, right? Can you see that? So these red lines indicate the patient's existing dentition, and the white line indicates how it should be, right? So in aligner what they do, we correct all these red lines. But what about these white lines? That has to be corrected by your laser, that is CLP, right? Correct. So this is the reason why we included this digital smile design into the aligner concept. And the second is to reduce the time taken by the conventional aligners. Got it? So what if, so you get this case. So what if you show patient like, patient comes to you like this, you send us the photo and I will send you this image immediately. You just show the patient like, this is how I can convert your smile. Does it become easy to convince the patient for the aligner therapy? Right? So what if I can show you this, she is a syndrome patient, all our real patients. See, what if I give you this image, patient will 100% say like, oh, I want to look like this. Alright? And this is along with the scientific background. It is not like, giving the image to ChatGPT and asking it to close the gap. The image will come, right? GPT image. Right? Not like that. It's totally designed scientifically. Right? And see, extraoral images. This is already, she was undergoing orthodontic treatment. There was some riding politics in between. We just tried to do some DSD and she agreed for the treatment. Of course, this needs an implant therapy as well. But this is the game changer, how a DSD can influence your treatment planning. Right? See, look at this image here. He don't require a aligner, but I'm just showing you the importance of DSD. He came like this. When we showed this image, he agreed for all anterior zirconia crowns or inline crowns. Right? Yeah, like that. Even a small fracture, the small corrections also you can show in the digital smile design. Because there are different cases. Like you look at this case, suppose if you want to show a patient like to correct the prognathism, surgical correction also you can show like this. You can move the mandible, see, front and back. For this many paid software they charge a lot of money for this, which you can do it in smile design. You want to look at this case, she came like this. Actually we just showed with the DST image, she agreed for the mandibular advancement therapy. Like that. So, our syndrome case, I'll just brush through. There are different cases with how you can convince for the digital smile design. Will not waste time here. Yeah. So he is the person behind this digital smile, Christian Coachman. He is called as the father of digital smile design, Christian Coachman.
As a technician, as a dentist,
Yeah.
and as a consultant.
He is technician,
Clinics,
consultant, dentist, and I think they have a legacy of more than 5 generations in dentistry. So he is the one who defined this term, digital smile design. I'll just show you what are the basic landmarks of his proposed. The modern dentist, will not waste time in this theory part. Yeah, you need to analyze the smile. When you give us the picture like this, when you send us the picture, a 2D image, okay, we need to analyze like what is the interpupillary line, what is this midline, okay, and these two horizontal lines. One is for occlusal plane, one is for the base of the nose. Okay, so with this you need to, any software you use, when you upload a 2D image like this, it asks you to first match with the interpupillary line. Okay, it is like a digital Facebook. It is like a digital Facebook, right? Yeah. Then the midline. Midline, we have 2 midlines. One is facial midline and the other is dental midline, right? Facial and dental. Usually there will be a mismatch of about 2 to 4 millimeter. That is acceptable. If it is 2 to 4 millimeter, don't try to change because it's very difficult to play around with the midline, right? Unless it is a full mouth rehabilitation. Yeah. So facial profiles. Patient will have these 3 profiles. One is flat, that is straight line. It is orthognathic. The prognathic here. This is prognathic. This is a retrognathic. The straight is orthognathic. This is normal. Just trying to tell you, because if you know these things, you'll be able to understand how the DST works. Okay. The face form, you have 4 different types: square, tapering, and oval. This helps in selection of teeth. Maybe you guys have heard in prosto lectures, final year PDS, must have forgotten now. I'm just refreshing your memories. Yeah, smile line and smile arc. This is very important. See, smile line and smile arc. Can you see this blue line? That is imaginary line passing through the tip of incisors, canine, and on the other side, this is called as smile line. Usually, we try to make it parallel with this smile arc. What is the smile arc? Smile arc is the imaginary line passing on the upper border of the lower lip. Upper border of lower lip. So if these two lines are parallel, patient will have a very pleasing smile. Right? So this is we try to match when you do the designing for the aligners. Correct? Yeah. So that is smile line. And the lip line, hardly we cannot play around much with the aligners with this smile line, because if a patient has a high lip line, medium lip line or low lip line, we hardly able to change this. Okay? But you should know what is the smile line. And the E position. Why it is important? You need to click photos in this E position. For smile designing, with the cheek retractor, ask the patient to say E, cheese, or some words like that, and click photo. Then what we get is we get a gap in between these two teeth. It becomes easy for us to design the dentition. Got it? This is E position, and this is E line. E line, it's an aesthetic line, imaginary line passing from the tip of nose to the tip of chin. If the lower lip is closer than this of 4 millimeter, we call it as prognathic. If the upper lip is very touching this line, that is called as bimax protrusion. So this is really helpful to differentiate the cases from dental to skeletal. Okay, that is E line. Okay. This is the golden proportion, golden percentage. This is the scale we use to the proportionate, the central, lateral, and the canine. Okay, that is golden proportion. And with this, we design the smile, that is age, sex, and the personality, the dental photographs, smile design in soft face, oral health, and the shade selection. Okay. So this is how the normal, the new modern setup looks like. Try to use the DSLR cameras for clicking the photos, the intraoral scanning image.
This is how modern dentist's practice looks like, where recent digital technologies are being used. We're going to show you how to use them for the virtual smile design, which can already be presented to the patient. A new method of digital smile design offers a possibility to present a smile even before the treatment beginning. The digital smile design is a practical virtual tool supporting the dental aesthetic treatment. It is a complex software for dental clinics and practices, which combines approved techniques used in aesthetic dentistry into a compact protocol.
Videos, short videos. As many data you can give, you will get a better results. This is how the designing, 2D design, which we try to implement in the ExoCAD for a 3D planning.
Which will take into account individual patients' features just before the treatment initiation has a fundamental importance, and that's the dentist to acknowledge patient with foreseen medication results. To carry the project out, it is mandatory to collect the base data, including scans, photos, and videos of patient's face, smile, and dentition.
So with this, we design. Okay. So now coming to the dental photography, I will not take much time in this because this will be a lengthy one. I'll just tell you a few settings in your DSLR, what exactly you need to change if you are using a DSLR. Otherwise, if you are using iPhone or any good Android phones, try to click photos with the maximum enlargement, like 3x. What happens when you put it 3x, you come very far away from the patient and you try to capture the real image. If If you go too close to patient's face, what happens? Your nose and mouth will look bigger and ear will look very small. Got it? But that is why we use DSLR, where the aperture is good and you get a real pictures. Okay? I'll not waste time with this. I'll just show you few settings. This is how a studio should look like. This format is given by Christian Coachman. You just see these are the LED lights 1, 2, 3, and 4. These are the lights. Okay, and the patient is sitting here, and the person is shooting from here. Right? We have a white background. We have a black background here. Got it? This is how a studio should look like. If you are using a DSLR, try to have this studio. And these are the 6 shots what we need for the designing part. This is the retracted view, exaggerated smiling view, the proximal view, resting position, fellow clock photo, fellow clock position. This is the occlusion view. Some basic 6 photographs. If you are able to send this properly, you just observe these pictures. When they click this photo, both the earlobes are same, and patient is not looking up or down. Patient is not turned his head left or right. Got it? Should be exactly in the center. Okay? Like this. Okay? 6 photos. And just say, these are the settings what I wanted you to change in DSLR. ISO, keep it at 100, 200. ISO 200 for intraoral photography. Okay? And shutter speed, keep it at 1/150 for optimum shutter speed. What happens if you keep very low? The image will become bright like this. It is 1/2. Okay. Suppose if you keep this is 1/150 and this is shaked image. Okay. 1/150 is optimum for intraoral photography. And the aperture, that is f stop, you say aperture. For intraoral, keep it at f22. For extraoral, you can keep it at f12. Okay, f stop 12 for extraoral, f stop 22 for intraoral. This is how much the aperture opens when you click the photo. Okay, that is f stop. 22. What happens? See, you record the depth of this image. You get the same clarity of second molar as well as the same clarity of central incisor. This is really very important. So f-stop you should concentrate on if you are using a DSLR. Okay. So if you are using a flash, it's very ideal to use the flash. Okay. If you are using the flash, it is called as through the lens, TTL. It should be 1/32. Okay. Just remember these settings for the DSLR. So with this, I'll just try to close this photography session. Okay, and contrasters. You should know how to use these contrasters. If you want to know, I'll just play this video. Let's see. Time is up. Okay. So now for the workflow, what are things we need for the aligners setup? If you are sending us the model, we use the model scanner and we convert that image to STL and work on that. If you are sending the STL file, that is good enough. Usually STL is very ideal for us. So you send this scanned image like this. This is the model scanner. Either one will be good for us. This will have more errors because this will carry the same error what you guys duplicated in making an impression. Got it? So with this intraoral scanner will be ideal for us. If you have the option of getting the scan done, that is ideal. And these pictures, as I told you, different smiling, exaggerated smile. Okay, so videos. If you have a 3D facial scan, good. We can use that 3D facial scan also. We use this DSD, merge the data, all this data, we merge it, and we do design the smile. Okay, generate the DSD model, and we use that for aligner planning. Okay, suppose if you have a 3D facial scan, these are the advanced one. 3D facial scan. You can use this free software in your mobile that is called as Bellus 3D. Does 3D in I think iPhone. But the here the thing is, when you export the file, they ask you money. For making image, no, it is free. When you try to send it to someone else, there is a toll gate there. They ask you money. Otherwise, we have a Meti Smile by Shining 3D, a very good one. This is from Shining 3D. This is just like intraoral scanner, but you can use multiple times, whatever, good image. Because what happens when you are sending us a facial scan, we need multiple scan, like one in smiling, one in resting, one in exaggerated smile, like that. Okay, so like this goes like this. I think I have made mine one, and this is mine. I got this done in IDS Germany 2023, I think. This is mine. Yeah. So we merge all this data, okay, along with the virtual articulator, and we get this model. From here we start the designing part. Okay. So that is one. And if you want to know the intraoral scanning, just like impressions, what we do, like the impression done by madam and the other doctor may be different, right? Right. Same thing can happen with the intraoral scanner also, right? So that is why you should know how to do a proper scanning. So how to do proper scanning? You just follow the catalog what they supply from the company. Got it? So if you follow all these routine protocols, like the distance from the scanner from the tool surface, the angulation, right? The time how you move it, right? All it matters. Got it? And there should not be any air bubbles in between, saliva. Right? If you take care of all that, we get a good scanned images. Angulation should be 90 degrees, and the distance should be 5 to 10 millimeters. That is the depth of scanning. When you scan the surface, try to keep a distance of 0 to 5 millimeters. Okay, you will get a good scan surface. The motion technique, and you need to record the bite on both the sides. This is also very important for us to set the final occlusion. Got it? And scan, verify, clean up, and then you send this. These are the sample photographs. We will send you through our Google form link. Look at this. One exaggerated smile, proximal smile, 45 degree smile. This is from the frontal side. Maxillary occlusal, mandibular occlusal, right occlusion, left occlusion, and the frontal in occlusion. Basic photographs. Yeah. Then this is our packaging. I think we have this box. Case here inside. Later, all of you can see this. It's a box inside with the remover, chibi, and the brush. And the specialty is we supply the MIC device along with it. On every case, we provide this MIC device. This is from Novalis only. 1650. Another is 810, and this is in combo. So how it works? By accelerated tooth movement. Let me show you that. The patient has to wear this 30 minutes in the morning and 30 minutes in the evening, along with the alignments. Okay. Okay. He's just trying to show you the unboxing. I showed you, right? Same thing. You just skip it because the time running late. So what is light accelerated orthodontics? Mechanism, how it works, it increases the ATP production. It stimulates the osteoclastic activity in the treatment phase, and after the completion, it stimulates the osteoblastic activity also, right? So that is the game changer in this MIC device. When your aligner is active, it will stimulate the osteoclastic activity. Once the aligner treatment is completed, when patient is wearing a retainer, then it will stimulate the osteoblastic activity. Got it? Yeah, that is one. And this is the MIC device. I just showed you how it looks like. Okay, and there is a lot of scientific evidence in the internet. You just might see the PubMed, the type light accelerated orthodontics. You will find n number of articles regarding the influence of light in orthodontics. See, you can do so much of, you can reduce so much of time in treating such cases. See here, Invisalign modded carotid deep by 80% they have reduced the time using the light. Here 57% reduced the time, 48%. Like this, there are already scientific literature available in the internet, in PubMed, medical publications. Yeah. So how it really affecting your light, the laser, the MIC light, it is stimulating this rank and rankel for the osteoclast for the bone resorption, and in retainer phase for the bone formation. Okay, and a lot of references here for the evidence of laser light on accelerated tooth movement. This is summary, and this is few case testimonials. Like you can see the screenshot also. I shared the screenshot. Look at this doctor. He is a physician. We started in 5th of August 2025. You just see the finishing year 2nd of December 2025 with the same MIC device. Just 3 months we were able to finish the midline correction. That is why I shared along with this dates there, right? And just like your 1, 2, 3, 4 in Novalace, we have 1, 2, 3, 4 for digital scanning, DST planning. 3 is laser assisted orthodontics, and the 4th is aligner precision. Okay, and this is how delivery looks like. This is also many other cases, right? So it's not simple it is. Absolutely no pain, very comfortable, and 50% of time. Okay, and this is our case submission form. That is the link to submit the cases. This is the contact number to send your cases. Everything is there in this case submission form. We'll send all the parts. I think you will send the details to all the participants. Okay. Some testimonials like here, before and after images, planning. I'll brush through all the images. Yeah, planning. This is BSD, and this is after installation of. This is how we get this, virtual mock-up depending on the BSD. With this, patient will agree, and then we go ahead with the installation of these aligners, and patient will wear this MIC device, right? Some other many cases like before and after. This is before and after. I will show you. I just showed you this case. That is your air pod, MIC pod, laser pod. Okay, this is finished case after 3 months. Just 3 months it took us to finish this midline diastema. This again 4 months, I believe, in this case. And she took around, I think she is one of she's PG student. I think this case got finished in 5 months, I think. This is my own case. I just try to do the designing for me. I'm still doing it. This is the 2D image, and I tried my 3D also. That is the face scan. face scan and the STL, both are merged there. And this is the DST what I got for my case. And this is how it looks like when you design in the Blue Sky Bio. It's a free software wherein you can merge the CBCT along with the STL. CBCT and STL. And when I merge all the three, I have all my CBCT, this is my own CBCT, STL, face scan and the 2D image. All are merged here in this. The next image I will show you along with the virtual articulator. See? So with this is the mock-up I got, but still now I have not taken treatment. Another few more testimonials. There are many cases to show. Just look at this case, how difficult it was. Got finished in just 8 months. This case. Testimonials and just brush through. In many cases we are done with this. I think actually plan was going on since last 6 years, but executed since last 1 year. Many testimonials. That is Smile Access by Novalis. Thank you. Any doubts, please ask. Was it interesting?
Yes.
Any doubts? But a lot of technicalities are involved in this. Yes, sir.
My question is that within the light exposures for the orthodontic treatments, according to the report and your experience, they all can accelerate the movement of the orthodontic treatments. But in the exactly case, how much fast exactly it can move, especially for some angular tubes? Is that could be move the angular tubes, or angulars will be
Very easy.